Hi, I'm Dr. Brad Castellano.
And I'm Dr. Stephen Holberg.
Together, we developed the Evenup device. Evenup is a shoe lift that we created to help with patients who have a leg length discrepancy.
A leg length discrepancy is created when we have to treat certain injuries or protect patients post-operatively. We have to put them into a fracture boot, which have really revolutionized the treatment of injuries and surgery post-operatively.
Fracture boots have been fantastic devices. You hardly see patients walking in a cast anymore, and that's because these devices took over. They made it much easier to walk. You're able to remove it to shower. You're able to remove it to treat a wound, remove sutures. It's been a fantastic device. The one problem, though, that we saw over and over again was it created a leg length discrepancy. Those patients had hip, knee, and back pain when they would come back for their first post-op visit or the first time checking them for their fracture, and universally, knee and hip pain were almost always discussed during that first visit.
Basically, the issue with the limb length discrepancy is that it causes a patient to limp, and it's the limp that aggravates especially pre-existing back and hip and knee issues, but it can also bring out new issues that patients aren't even aware of after wearing a fracture boot for even a short period of time.
So the way we managed this was the way everybody did in the beginning. We would ask the patient to put a heel lift in the shoe. The problem with heel lift is it does raise you a bit, but it doesn't raise you enough to balance you completely. And if you did add a lot of heel lift, your foot would slip out of the shoe, and you didn't really function normally with a high heel.
After we realized that that wasn't working as well as we'd like, we decided we would send patients to local cobblers to actually add a thick sole to the entire bottom of the shoe that was glued on permanently. That worked out pretty well, but it was expensive, and the patient then had to throw the shoes away.
I'll never forget the day that I had a patient tell me that they'd paid $90 to have a sole glued to the bottom of their shoe. I came out of that treatment room and looked over at Steve and said, we have to come up with something that's affordable, adjustable, simple way to treat this problem. And that was the day the Evenup was born.
The solution that we came up with is a lightweight shoe lift device that's simple to apply. It adjusts to two different heights and fits the right or the left shoe.
I'll never forget the day that my son saw a patient wearing an Evenup in the grocery store, and he ran up to the lady and said, my dad invented that. It's one of the proudest days of my life. And since that time, 6 years ago, thousands of patients now have bought and used an Evenup. It's been one of the most satisfying things in my career, and I think in Steve's too.
No doubt.